Terrific. Well, I'm going to go ahead and get started. Welcome, everybody. Thank you so much for joining us for our webinar this afternoon about navigating safety for medically complex children in COVID-19 environment at home and in the hospital. We're going to have some frontline experiences shared, not only by the folks at Boston Children's who work in the epilepsy and neurology department there, but also from caregivers who are experiencing what a lot of you who are joining us probably are, both at home in terms of how things have shifted for us and how our normal is, our new normal is really becoming something wildly different than what we're used to. And then as well as a parent who has been his experience being in the hospital in the midst of COVID-19, not with COVID-19, but in the midst of it, and what that's been like. So we're really pleased that they're with us. Just a few quick housekeeping things. We are recording today. This will be available online within 48 hours. So it'll be posted everywhere for people to see if you want to come back and see it or share it with others. On our website, deepconnections.net. All participants are muted, and we find that just kind of works best so there's not a lot of background noise throughout the call. But I will be taking questions throughout. If you have clarifying questions, I will chime in and ask the speakers to clarify. Otherwise, we'll hold those. Today is really going to be more about getting to your questions and concerns, so there'll be a lot of time for that. Just go ahead and drop them into the Q&A or chat box and I'll get to those. So let's go ahead and jump in. We're going to start with Karen Utley, who is first and foremost mother to Samantha and is also president of the International Foundation for CDKL5 Research, IFCR. So, oops, that's not what I'm supposed to do. All right. So Karen, all you.
Hello, and thank you for having me here today. Wow, who would have thought we would be in this situation, right? I never dreamed I would be isolated in my home for over 6 weeks, but here we are. I'm supposed to talk a little bit, I think, about the impact on us and my experience. We already, Samantha was homeschooled, so some things haven't changed a lot for us, but what has changed is Samantha likes to be out and about and she likes to do things. And so being home and not going to a grocery store or not going to the mall, those are changes. Also our therapies. Samantha is not real cooperative with a computer, so you know, we're just doing the best we can at home with activities of keeping her busy and trying to challenge her physically with her mobility and things of that nature. I think a big challenge for me is I'm a single mom, so it's really just me and Samantha. Her dad helps when he can, but in this situation, she can't be passed from house to house. And his wife works in a medical clinic, and so I feel like that's completely not safe. So it's all on me. And I was talking with someone earlier and said it becomes daunting. I really had to start just looking at one day. I wake up today, and this is what I'm going to do today, and I'm not really going to think about next week or tomorrow. And trying to keep myself in a positive thinking space rather than getting caught up in how long will this be or, you know, where will we be in a week or two. Just look at today, and this is where we are. I didn't prepare any slides. Perhaps I should have, but I didn't. I just wanted to just share from that perspective. For me, one of the things I think I'm seeing from our community is a lot of families are overwhelmed with the task of school and being responsible for all of that. And I have a situation where I'm the parent of, I have one child at home. I'm not only the parent of one child, but my other children are grown adults. And I know the families that have a child like Samantha or our children who are severely impaired, and then 2, 3, 4 other children, they're also trying to make sure they meet their educational needs and all of that at the same time. I feel like I'm overwhelmed. In that situation, it must be much more overwhelming.
Thanks, Karen. That's great. I think it's just great to hear what other people are doing. And I think your advice about taking it one day at a time is really important for all of us to kind of keep in mind, and using that as a tool to just stay in the present and not get overwhelmed with everything. So.
Right. And then you're also isolated from people you love, right? My daughter's favorite person besides me probably in the world is her grandpa. And she's used to seeing him all the time. And when she gets really mad at me, she goes to a door and hollers, Papa, Papa, because it's like, where is he? Why isn't he here to rescue me? So those types of things are hard.
Yeah, right. Yeah. And then it's, acting out. We have a lot of that going on around here too. I mean, the change of the everyday schedule, right? They're used to routine, and then things change. And so you see, a lot of other behaviors emerging. So, yeah. Well, thank you so much, Karen. It's really
Absolutely.
wonderful to hear from you, and you're doing a great job. Keep it up. Samantha's lucky to have you.
Thank you. I thought she would come over here and look.
Well, maybe
but she
she'll
hasn't
emerge
yet.
later. We'll keep our eyes peeled for her. We'd love to see her. Thanks again. So now we're going to hear from Issa Dawoodi, who is mother to Marie and president of Ring 14 USA. She's going to talk a little bit about her recent experiences in the hospital. So Issa, on to you.
Thank you. Thank you, Gabby. And thank you, you and your mother, for organizing all of this for the whole DEE community. Really just a huge effort and a great blessing to a lot of folks. So thank you. I hear you on the isolation. I'm actually the mother of 3 daughters myself. Marie is my youngest daughter, and I've got 2 college-age daughters who are both in kind of highly infected areas, one in Houston where Karen's kind of around, and the other in San Diego. And they have opted not to come home for exactly the same reason. So we find ourselves just me and my husband and my daughter. But luckily, we are not in a highly infected area in West Texas, but still the need to isolate. But I'm here to tell our story. So I guess my main point is, a lot of us have medically fragile children, and they're fragile in a time of COVID crisis, and they're fragile in a time without COVID crisis. So this is just one additional layer to the things that we deal with in our lives. And so Marie struggles with intractable epilepsy, as most of our children do. And in the last 2 years, aspiration pneumonia has really been a huge issue when she seizes. And so she is tube fed. And so if she happens to have a seizure right after a feeding, then there's almost no way to stop her from vomiting at that first convulsion. And so this is a reoccurring problem in our life. And so anyway, last month in March, believe it or not, we found ourselves in the hospital twice in March. The first time because she'd had 3 days of seizures and just had a slow respiratory decline that we were, after consulting with her doctors, we were uncomfortable dealing with it in the house any longer. And so she was shuffled up to the emergency room. And here's the thing is that until your child presents with an alternative to COVID, when they're under respiratory, when they're having respiratory problems, they're likely to be treated like they do have COVID. And so we found ourselves in the very place that we have been trying so hard to stay away from, and that was the COVID ward. And so for 24 hours until we could finally culture a bacteria that led to a different solution, and this whole idea of rapid COVID test, well, that's a myth in our area. It still takes 3 to 4 days to get these test results back. And so until she tested positive for something else, we were treated like we had COVID. And so once we were able to get another diagnosis and get, some kind of treatment plan in place, as soon as we were able to do those things and stabilize her, then we were able to get ourselves home as soon as possible. And I just started thinking, like, what have I learned from this experience that might be helpful to other families? And I'm just gonna share screen just briefly. Is that okay if I take over from you? Okay, here we go.
Yeah. And
Okay.
while you're loading up, we have a question. Were you concerned that they wouldn't let you stay with her in the hospital?
Yes, absolutely. I was concerned about that. And so, and in fact, so what we now know is that adults have to do this on their own. Right now, at least in our area, I can't speak for all areas, but for pediatric patients, they usually let one parent go in, but there's no exchanging of parents. And in the COVID ward, there's no in and out at all. There's not even in and out of your room, let alone out of the hospital. So what that means is that you have to be prepared for this situation. And so I came up, I kind of played off of the PPP acronym that we hear all the time in the media right now, the personal protective equipment for the first line workers. And I kind of came up with things that I thought might be beneficial to our families. And so I'm going to use that I'm going to state a different acronym for that, and that is prepare, prioritize, and adjust your expectations. And so, listen, these slides are kind of lengthy, and I'm not going to go into it all because Gabby is going to make this available to everybody, and I wrote about this in a blog, which I'm sure she'll post also. But I just want to say, look, the plan is for us to stay out of the hospital. But if your child is medically fragile before, they're medically fragile now. And so you're going to have to be thinking and preparing about, well, what happens in a worst case scenario? What happens if you find yourself in the hospital with a medical emergency with your child? What even happens if your child gets COVID or you get COVID? So what we know is that if you are prepared and have contingencies, you're always, even if these are adjusted, it's just a better place to start than thinking about this in the moment of crisis for the very first time. And so what's your plan if somebody in your family gets critically ill? How are you going to isolate from your child and things like that? If hospitalization is necessary, I really suggest that you have a bag. You know that you're going to have to bring everything for your child, especially all their medications and things like that, because it is a chaotic environment, especially if you're in a big city. And so, especially if your child takes, specialty medications that aren't readily available, like have those available. And me and my husband always have a list of things because hospitalizations are not new to us. And so we're able to throw together a bag in about 5 minutes. And listen, I'm not a list person, okay? I am not a list person. But, you don't want to make a mistake in this kind of an instance. You want to get it all together. So this is really a case where organization will serve you and your family best. And, all during this crisis, you're going to have to make different priorities. So Karen, I love, she was talking about you have to prioritize, who can come in and see your kids and, quality of life issues and things like that. But you're also going to have to medically prioritize when it is that this is an emergency. So you want to isolate yourself as much as possible, but you're also going to have to run risk and risk gain analysis on where is your child most safe. And we're just not going to get away from medical emergencies sometimes. So this is something that you and your doctor obviously should be in communication about. But I don't think we can escape the fact that certain medical conditions, even in this environment, are going to require in-house assessment and care, and respiratory disorders kind of fall under that category, unfortunately. And so I just encourage you to always trust yourself, you know your child best, to appropriately prioritize these medical emergencies. And the last thing I'm just going to mention really quickly is that you need to adjust your expectations, because whatever you're used to in the past with hospitalizations or how your household works in the past, everything's different now. And so as soon as you adjust your expectations, it allows you to kind of not be disappointed or thrown off guard by these kinds of things. So expect, if your child has a respiratory infection, it'll probably be treated as COVID for safety reasons until proven as otherwise. Expect a great deal of isolation during this hospital stay. And guys, this is hard, okay? This is hard on you to be with your child. It's hard on the rest of the family to be not with the family, because this is something that we're used to dealing with as a family unit. And to do this alone, whether you're the one with the child or the one left worrying out in the car, in the house, this is very difficult. And I can only imagine what it's like for the adults who are doing this all by themselves. So if you can mentally kind of prepare, then that's good. Also, you might be required to do more of your child's care than you're used to in the past, okay? These doctors and nurses, man, they're busy, and they're trying to leave you alone as much as possible. So that's different than what we're used to in the past. So diapering needs and all of these things that usually you get help with, you may be required to do a little bit more of this than you're used to. And I just want us always, my daughter is calling from San Diego. Anyway, I just want us to always be aware that our doctors and nurses, they're doing the best they can. And so, treat everybody with grace and gratitude and anticipate good care, but just be ready to stand up and speak on your child's behalf. The second time that we were in the hospital with aspiration pneumonia, and we knew it was aspiration pneumonia, we had to fight tooth and nail to stay in that pediatric ward. And we had to be very vocal, and we had to have our doctor on our side fighting for us. And we were able to stay there. But for 4 days, it was a constant battle. So anyway, good luck out there. It's a difficult situation. And that's all I've got to say. I'll pass it over to the experts now. Thank you, Gabby.
Thank you so much, Isa. It's really a fantastic write-up, and Isa has shared this online, so we'll go ahead and load this up and link to her website where she's got this as well. Isa, other question did come in. Did they allow you to use your own meds that were brought in without any issues?
Well, that's an interesting question. Actually, it was about half and half, okay? So my daughter takes Epidiolex. They didn't even have that available, and so they let me keep their own. Also, my daughter's on clonazepam, which is a dissolvable wafer that we swish up in water and put it in her G-tube, and they didn't have the wafers, and so it was kind of like if it was easier for them to do that, they let us do that. So Zomicide is a compounded medication. Also, they didn't have that available without having to make it. So it was almost like a half and half. But here's what I know is that absolutely on the first night, there's no way she would have even come close to getting her meds on time if I hadn't brought them there. So especially when you first enter your hospital, in my opinion, you have to have those meds ready. Okay, you got to have all of that laid out, because I think that and if you can have a label on them that says exactly what it is and what the dosage is, then what they've done is they just confiscate them, and then they keep track of them, and then they bring them back to me. But Alex, it's funny because its label is on the box, not on the bottle. And so they really just kind of trusted me to do what I needed to do. But here's the thing is that they want your child to get the meds, right? And so they're going to work with you. You just need to give them the best hand up you can. And that means bringing them all with you just in case they need them.
Yeah, that's great advice. And there was a follow-up about whether you have to pack your own food and everything. Were you stuck in your room or were you able to wander around?
Okay, so G-tubes are a real issue here. Hospitals in general, especially regional hospitals, will not have fittings for your child. So also in our bag, along with the food, you can make sure you have that cord. And my daughter takes Kate Farms, which is kind of an unusual vegetarian type diet that we're trying because of constipation issues. But anyway, so I brought all of that. So I brought tubing, I brought food, I brought diapering issues. My daughter is 15, and so she doesn't fit in pediatric diapers anymore. And this is something that hospitals may or may not be prepared to. So the whole idea is that you want to make this as easy as possible so that they can concentrate on the critical issues that they need to concentrate on, and you can do the care that you're used to doing. So I would bring everything. If you don't use it, who cares? Take it home with you, right? But take as much as you can. It might help.
Thanks, Isa. That's great. Yeah, and I think you bring up so many wonderful points about, people have been asking about how do you know when it's time to go to the hospital and when you are not comfortable managing anymore, when you're in consultation with your doctors and you just can't manage at home anymore. And then, of course, your advocacy, having your voice and using it is really critical in these times to make sure you're taking care of yourself and your child. So, I think one other thing I'll just bring up quickly before we move on to the folks from Boston is one thing we haven't talked much about is that in-home nursing care that a lot of people are going without now. And there are some people I know that day one when we heard about COVID-19, they just sent everyone away, people who get 24-hour care usually. And so they're struggling to maintain it now that we know this is really an ongoing crisis that will go on for quite a long time. And I think, Isa, you saying understanding the outbreak in your own area is important too, to know when to pull the trigger on some of those things. So I know it's very challenging without nursing care, without regular therapies, and for a lot of families, fear about not being able to get formula or G-tube supplies or ventilator supplies or meds. So that's something that we're also seeing a lot of. I'm going to go ahead and pass it off to Colleen, Chris, and Cheryl, who are joining us from Boston Children's Hospital. They all work in the epilepsy clinic, but I'll let them introduce themselves. Basically, they're going to introduce themselves and then take questions from you all just to hear what your thoughts and concerns are. And I think Colleen also is going to give a bit of an update on what we know about what is going on with COVID-19 in children with DEEs.
Hi, everyone. My first webinar. I'm very happy to be a part of this webinar. So thank you so much for having our team join you. I wanted to first say that professionally, I've been a nurse for over 24 years in various areas. But the last 5 years, I've been the clinical coordinator of the epilepsy and neurology, ambulatory outpatient services. So basically our clinics, we have a really, really large epilepsy neurology program at Boston Children's. I think we have over 80 neurologists and we have 15 epileptologists that specialize in pediatric epilepsy. So we definitely are a large regional center for developmental, and epileptic encephalopathy. So it's more common to us than it would be for the average person. And I think our perspective is a little skewed in that bit, because to us, these are our patients that we're managing on a day in and day out basis. But I am also a rare mom. My daughter has a rare DCX mutation. It's a type of lissencephaly that causes some cortical band heterotopia, fancy name for a cortical malformation. So she has associated severe refractory epilepsy and intellectual disability. She has cerebral palsy. As many of all of you have. She is luckily happy and safe at home and has not gotten ill, even with mom, and even my husband is also a nurse. So it's been interesting for us, kind of that added thing, but I have felt very well protected at my employer, and luckily, as many parents out there already know, it has not impacted the pediatric population to the level that it has the older population. Somehow this virus has spared our children, to date, which is wonderful news. It doesn't mean that we fear any less, and that the anxiety of the situation hasn't impacted us in so many other ways. The isolation, the loss of school and services, I deal with those every day. But I think that, I'm happy to talk about, I think we have done so much rearranging of how we practice and how we provide care to children. It's like a 180-degree turn of how we were 6 weeks ago and what we did, and people coming into and now doing all virtual visits, and every part of our management has sort of had a change. And I'm happy to speak to all those specifically when you guys have questions, but how we do labs, how we do diagnostic testing, really using a different way to manage our kids, using a lot of clinical judgment. Hopefully you have a good relationship with your providers so that you feel that, because we certainly are doing everything we can to protect the children and prevent them having unnecessary exposures in the hospital. So ambulatory wise, we are doing our best to ensure that your children do not have to come to the emergency room and inpatient right now. As it goes on, I think this will become more challenging, and we're already sort of dealing with that at the 6-week mark. It's, people can only wait so long before, they're going to need something. So we understand that that's a big change right now. So again, we're happy to answer those questions, but I definitely want you to meet the other panelists before we start the Q&A. So thank you.
Hi, everybody. I'm Chris Ryan. Thank you so much for doing this and inviting us to share with you. I'm a social worker here in the epilepsy program. I've worked at Children's for almost 9 years now. I loved what Isa had to say, because as we were planning this, I was thinking about, the caregivers and the families with children with rare, medically fragile conditions. I think you guys are all sort of uniquely qualified to manage this sort of quarantine pandemic in some ways, because you've been through this many, many times in the course of your lives, I imagine, right? And so I hope that you take some strength in that. Not that it makes it any easier, but anyway, you're certainly more prepared than I am, because I'm really struggling with managing my children's school at home and things. But so some of the things that I do in the event that it prompts some questions from the participants is I work on all the non-medical stuff here at the hospital for our program. So it's coping support, parental education things, working with schools to navigate IEP services. It's financial stuff, and I recognize that on a day-to-day basis, when you have a child with complex health needs, that there's always a financial strain, right? And if you're in a family now where there's a loss of income or a loss of 2 incomes, and that could be a real crisis. And so I have a whole bunch of resources that I'm going to send over that can be shared with you. Some of them are Massachusetts centric, but there are some national things as well. And I wanted to just share one thing that we've been talking a lot about in our social work department here, that we've been sharing with our staff here, but also with our patients and our caregivers. And it's a reminder of some of the basic self-care stuff. Some of these things may be really intuitive, and you've probably heard them before, but I think it's always good when we're in these moments to sort of remind people about this stuff. And so, as a caregiver, we're 6 weeks in, and I think everyone is sort of over the shock of those initial sort of bombshells that went off with all the closings and the quarantines and everything else. And now we find ourselves, in a marathon, right, that we didn't train for, right, that we don't know where the finish line is. And so I think we have to prepare for the long haul, right? And so that means as caregivers, we really need to take care of ourselves to run this marathon, right? And so that means rest and sleep, hydration, right? Trying to build as many routines as we can when we're at home and we don't even know what day it is. The more routines we can build into our days, I think the better it will be for us. I know I'm guilty of, with all the news that's coming out, checking my phone like 500 times a day, right? And so maybe thinking about turning off devices before bed, because anything you read on your Twitter feed or on the CNN at 11 o'clock at night, you're not going to be able to do anything about. And we know that sort of staring at screens before bed does not promote restful sleep, right? Another thing is, whatever supports were important to you before this pandemic, we have to try to figure out a way to connect with some of those. And I suspect that, with over 80 people here, that you're doing some of that, and I applaud that. But if you're connected with a faith community or an online support like this one, or meditation or some exercise, I think it's important to try to find a way to connect with some of those in some way that you can, right? And then the last thing I want to share that I think is really important for this, why I think you guys are all so uniquely qualified to deal with this, is that you guys have had to develop coping strategies to climb many mountains and go over many hurdles throughout your lives, right? And so I think it's important to remember what those coping strategies were, what you did to deal with your child's diagnosis, the times when you were hospitalized, and what strategies you used to get through, right? And I think that those will be really valuable to dealing with this current situation. So I just had to give that little spiel, because I think it's helped me for sure, and I hope it helps you guys. Thanks.
Thanks, Chris. Cheryl?
So I again want to thank you. This is my first webinar as well. So I have been in the epilepsy program at Boston Children's Hospital for the past 27 years. I've been the surgical coordinator for about the last 10 years. So I deal with a number of patients who see Dr. Pearl, who's our director, and I do the phone calls and all of the for patients for that, but I also help to coordinate the surgeries. On a personal note, I have a 29-year-old son who had epilepsy surgery at 6 months of age for infantile spasms, and so I know firsthand what these families are going through, because when you go through a surgical workup for your child, which takes months, and you put all of those eggs in a basket, and you are hoping and praying that this surgery is going to be the thing that's going to stop your child's seizures. And then this happens, and we have to cancel those surgeries. That is devastating to parents. And we don't even know when we're going to reschedule these surgeries at this point. So right now, we have all of our EMU patients canceled. We're not doing surgical workups at this point. We have done a couple of surgeries based on acuity. when we thought that we had to look at risk and benefit. We have done a few. We still meet weekly, and we have epilepsy surgery conference. We also have a subcommittee that meets once a week, and we go over when we reschedule these patients, how are we going to prioritize who gets scheduled first and who gets scheduled further out? Because as a parent, I would want to say, well, my child's surgery is supposed to happen in March. You know, why can't I have surgery in June? We don't even know when we're going to start to do surgeries again. So I think for parents, this is a very difficult time. Like Chris said, most parents who have gotten to the surgical workup have done this for a long time, have incredible coping skills. But I'm there to support them through this time right now, which is very difficult for them.
Thank you so much, Cheryl, for sharing your personal story as well. And I'm going to go ahead and just throw out some questions that are coming in. One of them is that somebody has heard there's some research or that they've heard some scenarios in which COVID-19 is causing severe inflammation in the brain and potentially causing seizures. Have you guys heard anything about how it can affect children and young adults with epilepsy in that regard?
We have had a couple cases that were sent around by the Department of Neurology and Epilepsy in some adults and in literature from Japan, because there's so few studies that and known incidences of any sort of meningitis sort of related COVID. We don't have any data to suggest that in pediatrics at this point that is solid. But certainly all viruses can have a potential to develop an encephalitis or a meningitis. We don't have any cases that have actually occurred at Boston Children's. And, we are lucky in that sense. I would say overall, I only know of one patient with a neurological condition that was hospitalized. And they have since been discharged, but they did require ventilation. It was a child that had tuberous sclerosis, and they were on immunosuppressant therapy, and they were older. They were not younger, and that is the only case of any patient with a COVID-related complication so far, fingers crossed. We have hospitalized patients, but I would, just to give you a rundown of the general sort of impact pediatric-wise, we have about a 33-bed neurosciences unit. It's a combination of neurosurgery, neurology, epilepsy, EMU, and neuro-oncology. It's typically very busy, and they have 33 plus beds, and the census today is 9. Because all elective procedures, as Cheryl mentioned, have been canceled, elective monitorings for epilepsy monitoring, unless they're urgent. So really the only children that are coming in are newly diagnosed, or certainly if they are developing, acute change in seizures where they need to be monitored. And that's pretty much where we have kept the care inpatient, overall. So luckily we have not seen any, related neurologic problems in our population. And so far it's really good news, but it doesn't change the circumstances of where I think everybody's at, because you're still having to isolate, and I think we're all still struggling with the impact in other ways. And I think obviously we still feel that we want to protect our children from getting it. We don't want to change the data at this point. We want to make sure that we're continuing to provide the things that are keeping our children safe from a public health perspective, which is great. But certainly as things start to move back, I think it is going to change how we function as a hospital and a neurology clinic altogether. Sorry.
No worries. I think we can, that was helpful. Go ahead. Colleen.
Thank you.
Need to do a couple of questions.
Yeah, that's okay. One of our doctors just walked in. Sorry about that.
Hey, it's a hospital. A couple of questions have come in that are kind of seeking some guidance about how things have changed in terms of what's happening in the hospital and what is allowed and not allowed. One of them is around epilepsy patients who require in-hospital testing, such as SEEG testing, and whether the threshold has changed for those kinds of stays or requirements, and how those are being handled. They move forward. Is there some kind of alternative being proposed?
So I can respond to that a little bit. So the SEEG patients, we actually did one patient this week. The majority of our patients have been canceled because we consider it elective at this point. Again, for most of our surgical workup, whether it's PET scans or SPECT scans or MRIs or fMRIs, pretty much most of those have been canceled at this point to be rescheduled. We just feel like the risk of them coming into the hospital at this point is higher than the benefits of surgical workup.
One other thing we have had meetings and come together for several things, including infantile spasms. So the approach with a newly diagnosed child with infantile spasms has been addressed by, we've had a team of nurse practitioners and physicians and nurses come together, and we are doing everything we can to avoid doing any hospitalization, even with newly diagnosed. So using high-dose prednisolone orally instead of ACTH, and doing outpatient EEG. So we have done a number of outpatient, like a 4-hour EEG for these patients so that they don't have to stay overnight. And they also discontinued doing blood pressure checks with home VNAs, and and having to do all of the protocols that were a little more stringent so that there was less impact, especially because when children are on the high dose steroids, the ACTH, the prednisolone, that they're at a greater risk. So they've really changed that protocol here at Boston Children's to try to prevent exposures for that high risk group.
Thanks. Yeah, that's really important to hear. So, Chris, one of the questions that we've heard come up is around financial strain for families. Do you have some thoughts about ways that people can manage this, deal with this?
Sure. I mean, I think it's probably pretty widely known about the enhanced unemployment insurance benefits that are being offered nationally now. If you're not eligible for those, that's obviously not going to help so much. There are a number of national foundations where if a family is in a really difficult financial position and they're at risk of not being able to meet their mortgage or their rental payments, there are some really good national organizations that can provide financial support. And one, it's called MBA Open Doors. I'm happy to send a link to this organization. They're specifically set up for families who have children with chronic illnesses, usually when they're having long hospitalizations that sort of interrupt work for a caregiver, but they're also responding amazingly during this pandemic for the same reasons. And so I'll send that link over to you. And so, but then there's also state by state, there's also a lot of smaller foundations that, so there, while there may not be access to additional public funds, right? There's ways to sort of offset expenses, whether it's utilities or rent or mortgage and things like that. And I'm happy. I'll send some of the information that I have. I'll send over.
Terrific. Thanks, Chris. Yeah, we also, on our resources page on deepconnections.net for COVID-19 resources, we have a number of different financial assistance programs that we've found that we listed there that people can check out as well.
Like in Massachusetts, we have, like a catastrophic illness fund in the Commonwealth of Massachusetts, and there are similar programs in different states. Some of them, the larger teaching hospitals like Children's also have, we have an extraordinary needs fund that's funded through philanthropy that where we can help families with day-to-day expenses, food and rent and mortgage and utility stuff, and there are similar foundations at a lot of the major teaching hospitals, and so that's another option to explore.
That's great to know.
I was going to say that several of the drug companies too are doing patient assistance programs for medications and things like that. So I know of a bunch of those. So if medication cost is an issue, then you should look into that, because a lot of the drug companies are offering assistance during this time period.
And Colleen may know more about this, because I don't do a lot of the insurance approval stuff here, but I know that a lot of the commercial insurances and the Medicaids are waiving some of the co-pays for our medications. Isn't that correct, Colleen?
Yeah, Epidiolex is one, for instance. They're waiving all co-pays on Epidiolex. I believe that there's certainly other ones. We've also been able, usually they only do, in Massachusetts, they only do a 30-day supply of medicines. Don't know why commercial insurances want you to do 90. Mass Health only wants to do 30, but whatever the case right now, we kind of will write on the script 90 days per COVID, and most pharmacies are filling this without extra cost. So that's something that we've been doing to just try to make it so that you're not going to run out of medications. That's been a big concern of a lot of our patients, is making sure that they have their medications. A very important concern, and definitely something that we've been working to try to prevent. So we've had a lot of success. One thing that came up was midazolam. We have been using an off-label sort of midazolam from compound pharmacies for younger children for rescue, where they use the atomizer and it's a vial. Well, midazolam is back ordered nationally because they're using it to sedate and ventilate adults. So Nasolam is really only covered for children 12 and up. So we've been able to switch people to that, but we have had to go, in some cases, to have people go back to Diastat because we have not been able to get, the midazolam. But we're still trying to get PAs, which we're still trying to work it through, but there have been little instances like that we've had to sort of move things around. So.
Sorry, muted. So thank you for that. That's really great to know. And Isa, thank you for sharing that about drug companies. That's really important. We're getting some love for Boston Children's. There's a couple of people who are saying thank you for what you're doing, and we love BCH. This is an interesting question too, because we were just talking about this, Colleen, in advance. Somebody said, for Boston area, if my child gets sick, should I go to Boston Children's or his regular care team at Tufts Medical Center? And I think this is, something to extrapolate about how you should manage your child's care in this time, and calling in advance, those kinds of things, so you know what the protocols are. Yeah.
Yeah, I would definitely say to call your neurologist, even if you're at BCH, because routinely, at least in our practice, we like to call ahead to anybody coming into the ED, and we want to make sure that our team, because obviously we're trying to not staff too many people just standing around exposing each other to COVID, so we have less people on hand and in person. So there's plenty of people in the ED, but for neurology, we want to make sure that our neurology team because we will personally see all the kids that come in. We're also trying to do direct admits so that they do not have to go to the emergency department. And that we've been able to successfully do that. They have recently increased testing as testing has become more available. So for instance, any child preoperatively who's having a procedure where there might be aerosolizing at all, they are testing 48 hours prior to any surgery. So for the two kids that did have surgeries this week because of urgent things, both of them were COVID tested prior to the surgery. Even if you are going to be sedated for an MRI or sedated for any procedures that we have to do, they will test. They will do COVID testing prior so that there's a decreased risk of exposures. And I think even if we're doing like an LTM or EMU or like a urgent phase 1 study or any kind of urgent study, they are testing all inpatient admissions to Boston Children's for COVID. So.
Terrific. So we have a question coming in from a caregiver who has a newborn that's exclusively breastfed, but is also the parent who's more experienced with the medical side of things for their 2-year-old who's medically complex. Do they let breastfeeding baby in, or do they have to decide which kid to be with? And I think this is something that a lot of people are thinking about, is how do you divide this care and manage that? So maybe you can start by sharing what the policies are at BCH or with other hospitals that you're aware of. And then, I don't know, Chris, if you want to maybe talk about.
We do allow one parent, no children under the age of 18 are allowed, obviously to reduce exposures. I don't know specifically about that question. It's a good question, and I'm not sure. I don't know that if they're not COVID positive, I don't think that you couldn't necessarily have a parent leave and then have a different parent come, and they would just need to be screened. You know what I mean? Like, I don't, if you were COVID positive, you definitely cannot leave. But if you are not COVID positive, parents can alternate bedside to this. As far as I know, they just need to be tested. So they have not changed that yet. And there was even a talk in our town hall today about, are we going to leave the kitchens on the units open for families to go in? And yes, they think it's important. I mean, if you need to go out and get your child a juice, or, you know what I mean? They haven't gotten to the point, luckily, because they're screening, they're making sure, so then we know who is COVID and who's not. And then those parents definitely have to wear a mask. You have to wear a mask the whole time you're here, and you have to be screened. And obviously, if you have any symptoms, you will not be able to come in. But other than that, it's, they still are allowing a parent to be at the bedside and alternation and that sort of thing. So
it sounds like you probably should check in advance with that as well. Since
that specific question is a good one.
Was that there was one parent in and that's it, no shifting. So somebody had asked about, what is the, the status of what your census is, and you shared that you have a 33-bed unit that's got 9 kids right now. So, and I think as a follow-up to that, if someone does end up inpatient, can people drop supplies off of the entrance or be delivered to your room? Will you still have access to the outside world somehow? I think that's probably another, hospital by hospital having different rules, but what have you guys seen?
Yeah, I think they would strongly encourage alternate arrangements. And if they're COVID positive, you definitely are more restricted, so.
Yeah. Okay, so we've got another question that came in that's a really important one to think about. So if it comes to new end-of-life talk while children are in the hospital, do they allow both parents and all the wishes that we might have for the end of life around activities you want, like a casting and prints or just being bedside?
So, I know that our child life specialists are still on the floors, and who are the ones who do a lot of the end of life support. And our PAC team is still also active here in the hospital. In terms of, again, if it's a COVID situation, I suspect it would be completely limited, but not, I imagine that there would be accommodations, again, hospital by hospital. I don't know if you want to add anything to that, Colleen.
Yeah, I definitely think that we would work with the team, and if that, thankfully, we haven't had that issue come up so much as we have seen with adults, on the news. I know this has really been a sort of a very, reported thing with people being alone and the nurses trying to get their families online. In pediatrics, we definitely are able to work with the families and get people to visit. Our visiting policy is definitely a little different than the adult hospitals that you're hearing about on the news. So.
Great, thank you. Well, it seems like we are just about at time, and luckily we have gone through all of the questions that came up. So I want to say a huge thanks to Colleen and Cheryl and Chris for joining us from Boston Children's Hospital. Thank you for all that you are doing. You are representatives of the wider healthcare community right now who are really caring for so many of our children remotely and on site, and we're grateful that we have such amazing providers that are helping with our children. And also a huge thanks to Karen and Isa for sharing your experiences. I know you validated a lot of what I have been feeling and kind of echoed some of that about the challenges and, you know, the kind of just feeling like you can't know what to expect, and frankly, things are going to be different than you imagine. And you know, I think we're all kind of doing our best to do what we can and be prepared. But these are really unprecedented times, and we're all trying to get through it as best we can. So this community is really a wonderful support to have all of these other rare families to connect with, and including you, Colleen and Cheryl. You know, you guys are part of the team, and so a huge thanks to everyone and to the families who joined us today. We know your lives are really busy, and everything is uncertain and scary and much more difficult without more help and around, but we're really glad you could join us. This webinar will be posted on our website within 48 hours. I'll be posting and you'll be able to see where that is. We have a couple of other webinars planned that next week we're having a webinar with somebody from Invitae, the genetic testing company, and then a genetic counselor from Colorado Children's who will answer, well, first they'll present a bit about kind of what DEE genetics is looking like, how things have changed, the different kind of testing, how to read a genetic report, all those kinds of things, and then answer a lot of your questions. And then in the interim, we have a couple of others that we're planning, which we'll announce when they're finalized. But in May, we're really excited about another webinar we have with Dr. Anoop Patel at Nationwide Children's, who's going to talk about efforts that are underway to improve epilepsy, pediatric epilepsy care, and things that we can do as families and caregivers to help influence and make changes to that system. So it will definitely be a conversation, an opportunity for you to share what you're seeing and hearing and feeling and thinking. So as always, thank you everyone for joining us. Visit our website. We'll put up resources that Chris and others share. If you have a resource you'd like to share, please feel free. And we will see you next time. Thanks everybody. Stay safe.
Thank you very much.
Thank you.
Take care.